This conference will now be recorded.
Hello everyone. Am I audible?
Yes, ma'am.
Yes,
Okay.
ma'am.
Welcome to this orientation session today. And we'll wait for a couple of minutes more for other people to join, and then we will start with the session, right?
Okay.
Okay.
let's begin the session. Are you people able to see my screen?
Yes, ma'am.
Yes.
Okay. Uh, I don't know how many of you actually know about the details about the exam, that what all this exam is about. I hope you know about the beginning, that what all we do. We'll have to apply for eligibility first and then expression of interest. Do we know about that?
Last time actually I had joined your class. I could not complete that. So I had applied for eligibility, ma'am.
Hmm.
Yeah.
See, all of us who wish to go through this MRCOG journey, this is the first exam. Part one is the first exam, and it is all about basic sciences. But before applying for the exam, you will have to go through these things, like whenever you open the site of this medical, this RCOG, there is an form for eligibility and expression of interest, that yes, I want to appear in this exam. And it generally takes a couple of months for them to, whenever you will apply, and they will give you that yes, you can appear for the exam. So whoever has not yet applied, please apply for that, so that at least you are eligible to give the exam. And regarding part one thing, part one is all about basic sciences, or what we say about this, like it is about MBBS. All the subjects of MBBS pertaining to obstetrics and gynecology. I will be talking about it in detail after a few slides. So, this is the first step, which is like if you are following your dream of becoming an MRCOG. So, this is the first step. So, this is the gold standard examination that all of us know prior to this. Anybody who wants to shift or does not want to shift, it is just like, I mean, it is a dream degree for all of us. So, this is the beginning. What is the importance of this slide? That as we know, for becoming MRCOG, you should have at least 4 years of clinical experience in OBS and gynec. So, most of us are all practicing gynecologist already. And because our branch is like that, that we get very little time to study. So, what is this course all about, and why do we need a course? Point number one. And what is the key to success in this examination? See, it is all about how you manage your time. Because of your busy schedule, most of us are having our families and hospitals and everything, our duties, whatever. In spite of all that, we have to take time, and trust me, even 2 to 3 hours per day of dedicated smart study. What does that mean? That we should not beat around the bush, that we are doing this and doing that, and at the end we are doing nothing. So this course helps you know which what is important to study and what we can leave behind, so that we can actually go through this examination. This is a cycle or circle, which probably seems simple, but it is very difficult to follow this throughout an year, because if you will go completing your courses from part 1 to part 2 to part 3, it will take probably 10 to 12 months. So all over during this your journey, most important is your dedication towards the thing, that no, I want to do this. Because many a times it will happen that you are very tired, and you think that, oh my god, ye bach gaya, wo bach gaya, there are so many things to do. and you think that okay, it's okay, I'll not study today. But this is not going to happen. Like if you will leave in between, then the success rate is very low. So, making a schedule is important, following that schedule with dedication and perseverance, and finally, decision making. All of these are interrelated things, but we need to follow a schedule and study only what is important. So, mostly, this orientation session is for those people who are planning to appear on 4th of July 2023. Uh, Eligibility deadline is Monday, 6th March 2023. Before 6th March, please apply for your eligibility, that what I was talking about, na, that eligibility criteria. Please apply for that. And then expression of interest. So if you are dedicated, like you have decided that you are going to appear on 4th of July, then please apply for it today only. Don't wait for March, because it takes time for them to complete that process and to give you the eligibility, and then you will make your mindset then we are already late. So please apply for eligibility and your expression of interest as early as possible. And the booking window application opens on 27th April. This date is important. Please save this slide if like wherever you want to, because it is the exam seats are always on the first come first serve basis. Uh, I don't know about all those people who are attending this session, about their background, that from which place do they belong, and where will they appear for the examination. But it is always like the booking window opens and you get the token, and it is just like a race. You'll have to apply quickly, and so that you get your seat through and a center of your choice also. So whoever is preparing for 4th of July, please mark these dates. And the booking window closes on 9th of June. Then there are fee structure. These things are actually easily available on the website. And generally, India is in band B. So accordingly, fee structure we will have to keep in mind. Now, there are some things which are typical for RCOG exam. Like there is something called as SBA questions. What is the full form of SBA? When I was appearing for the exam, I wondered what is SBA. SBA is single best answer questions, or the multiple choice questions, which we like in India we talk about it like a multiple choice question. So there will be four choices and you will have to select one single best answer. There is no negative marking sort of thing over here. And you will it is a computer based exam, so they'll give you a center and you'll have to go to the center and click on your answer whichever you think is correct. There will be two papers, paper 1 and paper 2, of 150 minutes each, separated by a break of 1 hour. And that 1 hour break is actually not mandatory, it is not compulsory. If you want to take, you can take, otherwise you can also continue in continuation. In total paper 1 and paper 2, you have to give the answers of 200 SBAs. And part 1 is that way is pretty okay, that most of the questions are recalls, like much repetition is seen in part 1 exam. So, how do we prepare for part 1 exam? There are some theory books which I'll be discussing right now. And you have ample time. Today is 2nd of January and you are going to appear on 4th of July. Since you are having ample time to study, please start with the theory books, because as I have already said that all of us are practicing doctors. So generally those basics of anatomy, biochemistry, physiology, they are somewhere lost in our head. So we need to brush off those things, brush off those dust from that. And these theory books are really helpful, because they always highlight the important points that we need to know for this exam. and it is really impossible for us to mug up all the theory at once. So in this is my suggestion, and somehow it works also, that half of the day you read the theory and rest half of the day solve some of the questions regarding to that theory, so that you come to know that how much you are retaining and which type of questions are actually coming from that part of the theory. I hope I am clear till now.
Yes,
And
ma'am.
Mm. Anyone who is having any problem can anytime ask any question in the group. We are really here to help you out and answer your questions. And please start reading. At least start from 2 hours per day, 1 hour theory and 1 hour questions. There are question banks, and then there are recalls. Recalls means past years question papers. They are really important, and you will see that at more than 70% like of the questions are repetitions. So if you get all of them correct, then you are already through. And there are something called as green top guidelines. This RCOG website, it contains all the study materials regarding. In part 1, not much of the guidelines are asked. Part 2 is all about guidelines, but in part 1 some important guidelines very superficially we need to know. So my idea is that first of all we will start with basic sciences and theory books, and once we are done with it, then we will shift to guidelines. Now we were talking about these theory books. These are actually very good books, and these are available online also, and on this in soft copies are also available. Please start reading them, because I mean they are really very good. And whatever, if you feel any problem that we are not able to follow, that we are here to help you out. But 1 2 3 4, at least if you're not able to read all of the four, read at least two, so that you come to know what to do. And all the basic things of all the main topics are mentioned in these books. This I already mentioned, but I will still emphasize that these recalls are very, very important. So, we are here to provide you all the material, but you start reading and start making just a dedicated habit to read at least 2 hours per day. Initially, it will be difficult, then sooner or later, it will become a habit. And please read recalls and read all the theory regarding all the four options. For example, there is a question in which one answer is correct. So read everything that you can read about that right option, and don't leave the other three things behind. So whenever you are following a question, that this is a question, please read everything you can find about them from the given books, about all the four options. That ways you can cover most of the topics of those recalls of the past 5 years. And summary of green top guidelines, these are only the summary, that is the initial 1 or 2 pages of those guidelines, in which they always mention this is important, this is important. Only the important lines of the green top guidelines have to be learned. And there is this the importance of practice group, because these things are very volatile. Today you will read and you will think that wow, I remember each and everything, and after 4 hours or after 12 hours everything is like lost. So practice group, we are making a core practice group. The whosoever are in this group will be regularly posting questions and regularly discussing those questions. Discussing your problems is the way to success, so that you retain the retention of the thing, that what we have read is very, very important. You cannot read each and everything before going to the exam. So today what you are reading, read as if it is just for your exam. And after we all have done our MBBS and post graduation and everything, so we know it is always better to discuss things amongst yourself, and whatever is discussed is retained more. So that is my suggestion, that we will be starting off with questions and answers and recalls and everything. And whosoever is having any problem or wants to discuss anything, please put up in the group. Or if from your point side you want to ask some questions, you can actually put up it in the group, and we will have a good discussion regarding that question and regarding that topic. What all are the highlights of this course that we are starting? You will have module wise test, a practice group as I already told, study material, mock test to practice, and see, if it is just a bond, we are here just to guide you. So if we go through part 1, then the bond can continue up to part 2 and part 3. And definitely we'll be having live sessions and videos also. During the live sessions you can ask your problems one to one. There are these some of the questions just for examples like I have taken, so that you can come to know that what type of questions you are going to find. These are mostly recalls and pertaining to many varied topics. Like first one is, which of the following is true of the anterior pituitary gland? All of you are free to answer. Whoever thinks that they want to answer, please unmute yourself and answer this question.
Answer is B. It is connected to the thalamus by neural tissue.
Mm-hmm.
Answer might be E. It produces hormones which share a common beta subunit.
Anyone else?
B.
In my view, the answer should be it produces glycoproteins. See, this beta subunit is never common, because it generally produces glycoproteins which have a alpha subunit and beta subunit. And as all of us know that alpha subunit is mostly common and beta subunit is different. That's why we always go for beta subunit measurement whenever we are doing any blood test. So answer is D. And the pituitary stalk connects the posterior pituitary to the hypothalamus and not the anterior pituitary. This is the answer for the first person who answered na, that the anterior pituitary is connected. It is always the posterior pituitary. And it is contained in the pituitary sella within the optic chiasma and hypothalamus as superior relations. Mostly, this anterior pituitary produces hormones like TSH, LH, FSH, and all of these are glycoproteins, and these share a common alpha subunit and not beta subunit. So the answer to this question is D. It produces glycoproteins. So it was just a prototype of a question. I just wanted to say that all of us are doing these things day in and day out, and we are measuring these hormones and everything, but we need to go in such a detail that we need to be very specific and meticulous about anterior, posterior, the relations and everything. So next question. With respect to the structure of chromosomes, the short arm of the chromosome is the Q arm. Metacentric chromosomes have no centromere. Metacentric chromosomes do not contain histones. Acrocentric chromosomes are usually involved in balanced translocations, and acrocentric chromosomes do not have a centromere.
It's D.
Hmm.
It's D. Acrocentric chromosomes are usually involved in balanced translocation.
Anyone? Any other answer from anybody else? I feel very well answered, and this is the right answer. So we'll have to study about the chromosomes. What are metacentric? What are acrocentric? What are submetacentric? Uh, so metacentric is the one which has the centromere in the middle, and we will have to remember the names, these numbers also. And acrocentric is one who have the centromere close to one of the end, and these are the chromosomes usually involved in balanced translocations. That is important. Submetacentric have centromere in between. And chromosomes have two arms, a short arm and a long arm. Short arm is called petit arm P and a long arm Q arm. Go for this next question.
It is A, IgA. All the body secretions have immunoglobulin A, which act as protective mechanism, and it exists as a dimer form.
Mm-hmm. Everyone feels that the answer is A, or somebody wants to add anything?
A.
See the slides actually.
You can't see the slide? Everyone is able to see this slide? Yes, the answer is A. This is a part which I have taken for just for this question. Otherwise, the importance is that we have to actually mug up the structures of all the immunoglobulins and where they are found, what are the functions. So this is IgA, very well said, and it is in the dimer form. And it is generally found on the mucosal surfaces and the secretions. And it plays a key role in the neonatal immunity as it is secreted in the breast milk. At the same time, these are other antibodies like immunoglobulins. Which one is the has the highest weight? Anyone? Are you there?
GM, ma'am.
IgM, it is a pentamer and it is the first antibody to be synthesized. See, these are very, very like important topics because every time you will get a 2 or 3 questions from these immunoglobulins. A woman presents to the OPD with increased vaginal discharge. Examination reveals a homogeneous discharge with a fishy odor. Clue cells are found on microscopy. Which one of the following options is the most likely diagnosis?
Bacterial vaginosis.
Yeah. So generally clue cells and bacterial vaginosis and fishy odor. Important things. Clue cells are typically found in bacterial vaginosis. And what are clue cells? Another very commonly asked questions is what are clue cells actually? These are epithelial cells from the vaginal wall which are covered in bacteria and exhibit a stippled granular appearance on a wet mount of vaginal secretions. In this whole line, what are the important words? Clue cells, bacterial vaginosis, epithelial cells, and wet mount. Most of the questions are coming when they will make a permutation of combination of any of these two terms. Bacterial vaginosis typically presents with a homogeneous discharge, which is often associated with a fishy odor and may be gray in color. The presence of clue cells is one of the criteria used to diagnose bacterial vaginosis on microscopy. Clue cells may be seen on both wet preparation and dry gram-stained vaginal slides. Trichomonas vaginalis similarly presents with fishy smelling vaginal discharge. However, the discharge is often described as frothy. If measured, the vaginal pH is raised in both bacterial vaginosis and trichomonas. However, clue cells are not seen in trichomonas. Microscopy would instead demonstrate a motile flagellated protozoa. Why is this explanation important? Because sometimes you will get that the patient came with discharge and it showed a high pH. So whenever it would show a high pH, then there are only two differential diagnoses, either bacterial vaginosis or trichomonas. Then in the other line, they will say that it demonstrates a flagellated protozoa. So what is the most common cause? Then the answer turns out to be trichomonas. But if they say that it has got clue cells, then the answer is bacterial vaginosis. Microscopy would instead demonstrate motile flagellated protozoa. Chlamydia trachomatis and Neisseria gonorrhoeae are most often asymptomatic in women. However, increased vaginal discharge may be a presenting feature. Neither Chlamydia trachomatis nor Neisseria gonorrhoeae are typically associated with a fishy odor. Chlamydia cannot be diagnosed on microscopy. And Neisseria gonorrhoeae is the most likely diagnosis when they say that it has a gram-negative intracellular diplococci. uh, Later on when we will come to this vaginal discharge topic is very very important as far as part 1, part 2, part 3, three of them are concerned, and we will have to remember these important key points. To which class of drug does metformin belong?
It's
Biguanide.
biguanide.
Perfect. Now, as I already said, that whenever you will read this question, like as such, this is a very simple question. Most of the people will be able to answer this question. But important is during reading, during your recalls, please read about all the options that learn the examples of anti-metabolite which are important from gynae point of view. Learn the examples of anti-progesterone. So metformin used in the treatment of PCOS is an insulin sensitizer and is a biguanide. With regard to the incorrect answer options, we should always read that, like for example of anti-metabolites. These are the examples: anti-progesterone, mifepristone, LHRH analog Zoladex, estrogen agonist tamoxifen is a selective estrogen receptor modulator, and clomiphene. Which of the following is true regarding heparin?
Induces thrombocytopenia in 20% of the patients.
Anyone else? Any other answer? See, these questions are really tricky. And in these questions, you have to be sure about these percentages. You are correct that heparin sometimes induces thrombocytopenia. But is it 20%? Is it that high?
The
It's
E
low.
option, E readily crosses the placenta.
Oh, heparin is a large molecule, dear.
It does not cross placenta.
It does not cross placenta. No?
Ah, it
Acha,
does not
okay.
cross the
Yes,
center.
yes.
It is that what is true. See, part one is a simple exam as compared to the other two parts. So in part one, generally they will not give true except. Those except things are not coming in. And very grossly, very close answers will not be there. So that is what I'm saying, because you have to cover so many subjects. It's always good to cover the important things. In this,
Mm.
the answer is A. Heparin is a strongly acidic mucopolysaccharide and not a protein. So if we come back to this question, E is already out of question because it does not cross the placenta. We know this thing, and it is a protein that they have written in point D. So point D is now off. So heparin is a mucopolysaccharide, important, and as the name suggests, it is derived from the liver. Heparin has many actions, but principally it enhances the antithrombin 3 activity, which in turn inhibits the factors 9, 10, 11, 12, and thrombin. This line is actually very important, and you will have to mug this up for part 1 as well as part 2. Heparin also activates the enzyme lipoprotein lipase in plasma, lowering the plasma triglycerides and inhibiting platelet aggregation by fibrin. a side effect in up to 5% of the patients. See, it is that important. And please try and learn these percentages from day one, because as I know, if you'll study hard, you will actually clear the exam. So whenever you will go for part two, there they will ask these percentages, and in part three, in that is what face-to-face examination, you will have to quote these percentages. So try to remember, and if at all you are not able to remember, please make out like 20% is too much for a side effect to happen. So don't fall into that trap. A side effect in up to 5% of patients is heparin-induced thrombocytopenia, HIT. As heparin is so strongly acidic, it binds avidly to proteins and does not readily cross the placenta and other membranes. Pregnant women requiring anticoagulation with warfarin, whatever. Mm, what was that last word? I'm not able to make out. Whatever. But see, so take home message is that heparin is a protein, is a mucopolysaccharide and not a protein. And HIT happens in only 5%. And the main principle of action is it enhances the antithrombin 3 activity. What happens to both the systolic and diastolic blood pressure in the first trimester of pregnancy? Correct answer I have already mentioned. Anyone who wants to ask anything in this? Am I audible, people?
Yes, ma'am.
Uh-huh. So answer is
It
B,
does,
that the
it does
systolic
not
blood pressure
change.
does not change and diastolic decreases towards the end of the first trimester. So during the first two trimesters of the pregnancy, the systolic pressure remains unchanged from the non-pregnant state, and the diastolic pressure decreases partly due to arteriovenous shunting from the placenta. By the third trimester, all the blood pressure is similar to that of term. Which substance gives the most accurate measurement of the glomerular filtration rate, GFR?
Inulin.
Very nice. The answer is inulin. Inulin is neither absorbed or secreted by the kidney, therefore, the amount excreted after a steady state infusion can be used to determine accurately the GFR. Despite this, creatinine gives a very close approximation and is used as an estimate of GFR in place of inulin. At the end of surgery, you notice an area of burn near the attached diathermy plate. The diathermy plate seems to be partially detached. Which of the following would be the most likely etiology?
It's
Insulation
E, due
failure.
to the plate. It is the E, due to plate not being secured properly, the current was concentrated and the smaller area, and that is why it caused the burn.
Very good, very nice. Why we have kept this question over here? Because biophysics is very important. This diathermy, this cautery, they are very fond of these questions in all the three parts. So we will read this in detail. The answer is due to the plate not being secured properly, the current density was concentrated in the smaller area where the plate was attached. The amount of thermal damage is dependent upon the current density and the size of the current. The current density in the tip of the needle will be very high as the current is concentrated in the small point. So the plate used for the return electrode in cases of monopolar diathermy has a large surface area of contact, resulting in a much lower current density. Any thermal effect is therefore widely dissipated. This highlights the need for the whole surface of the plate to be securely attached to the body. Which one of the following has a lower concentration in the cerebrospinal fluid than plasma?
Bicarbonate.
Anyone else? These are some of the things which actually we need to mug up. There is uh, no basic behind this, but the answer is glucose. So the concentration of glucose in CSF is 64, whilst in plasma it is 100. And we have mentioned all the other figures. So the concentration of bicarbonate is 25 in CSF, while in plasma it is 24. So this is all like chloride 130 and 100, magnesium 2.2, 1.6. It is generally a table which we need to remember about the concentrations of main things in all the body fluids. This is something from embryology. Can anyone answer this question?
Ma'am, I can't see
What
the
do
screen. Screen is not visible.
to everyone? Can anyone see?
Yes, ma'am.
I can see.
Dear, probably please check your internet. Sometimes if the internet this is slow, na, I will change it again. Okay? Can you see now?
Yes, ma'am.
Hmm. Please take your time and
Meson
anyone who wants to go for it, structure B. What is the structure B?
It's the option C, mesonephric tubules.
Anyone else? See, this option D is ureteric bud. Huh? This is a typing mistake. As far as our part 1 is concerned, this diagram is very important, and the development of the genitourinary tract has to be by heart. And your answer is correct here. It is mesonephric tubules. So this is a section of the embryo where these important things they have already shown. Where is the mesonephric duct, mesonephric tubule, ureteric bud, cloaca, and genital ridge. Whenever we will be taking the sessions, we will be talking in detail about each and everything. But today is just an orientation or a sensitization class that like only the important things we will study, but we will study them really in depth so that we can answer all of the questions pertaining to that important topic. So that was all from my side for today's orientation class, and we will kickstart this course from now onwards and cover most of the important topics. Anything that you people, anyone who wants to talk about anything, please feel free to ask.
Ma'am, you have suggested 4 books, but please, ma'am, according to your experience and your knowledge, kindly jot
Mhm.
down them from ranking 1 to 4, ma'am, because it's not possible for us to uh, decide. Maybe I may be liking some book, but some revision notes, as you told, are very important. What is the second book we should go for if we plan to go for only 2 books according to the time we have as practicing people?
See, if you are able to by heart that revision notes only, na, that is
Yes, ma'am.
sufficient. But the point is
Okay.
in revision notes in very small font, they have given too much of the information.
Hmm.
And if you are comfortable reading that, and if you are able to read the whole book, then you should, then it is more than enough. more than enough if you are able to remember those revision notes and apply them in recalls. So I have given you four books to because it is your choice. Someone may like one book, someone may like the other book. All four of them are good. Revision notes is the best. And if you are not able to remember what is written in those revision notes, then go for the other one. But read one book at a time, and once you are through one book, stop reading further theory and start doing recalls. This is the only way out in which you can succeed in the exam by putting least effort, because each and every book mentions more or less the same things, but we need to remember what they are trying to emphasize on. So according to my experience, it is like I can say that revision notes is the best book, but if you are not comfortable reading that, get any of the book, any of the four. All of them are equivalent, but read it and read it thoroughly. And after reading it, please start practicing SBAs and recalls and then read it again. In, Instead of reading too many books, get one book, read it completely, and revise it completely. That is all.
One more question, ma'am. On Telegram, we have multiple free groups, and most of the people, because uh, we are not having so much of orientation before we joined you. So, do we need
Hmm.
to follow all those groups for, because every piece of group is having some or the other information. There are some groups which are running from 2016, some are running from 2017, and then when you start from the beginning, it is
Hmm.
also giving a lot of information, but as you said, ma'am, it's very difficult to um, concise that information. So it's very luring to add into to get added into all the group. But is it necessary or is it not necessary?
Nothing is necessary. Nothing is necessary, dear. See, everyone has his or her own method of studying. If you will talk about me, and according to my experience, I never followed all of these groups, because इतना time ही नहीं होता है that you go for each and every group and see what everyone is doing. So follow one group. If you are a part of this group and you will study whatever material we will be providing you, that will be more than sufficient. As I already told you that this is not about reading many things, it is reading about important things, but remembering them very meticulously, because whenever you will be appearing in your exam, at that time there will be lots of doubts and dilemmas, that I had read it, was it A, was it C, and at that time the problem starts. So if you will ask me personally, then please follow one group only in which you feel that the things are going on the right track, and practice as many as questions as you can. And whenever you are not satisfied with any answer, just put in the group and ask this group that what does this group feel. And believe me, if you will follow only one group and revise things many times, at least twice or thrice, that would be sufficient. Instead of following so many groups and getting confused, it is always better to follow one or more than one, at least one, and not more than two groups.
Okay, ma'am. Thank you.
Yeah. So I hope this session, uh, some clarity you people must have got, that how to approach this exam and how to proceed. So first of all, take home message would be like, follow this, go for this eligibility and expression of interest, and keep in mind the date of booking, and start reading one theory books. And we will be starting posting questions from tomorrow onwards, so practice those questions and read about all those options. And whatever you feel that you are not getting anything, and anything, please feel free to ask your questions in the groups, and we are there to answer your queries. And that's all for today.
I had a question. I know I might
Yes.
sound really silly and old,
Oh no.
but I
Hmm.
had appeared for the Part 1 exam when I was
Hmm.
doing my residency in 2003.
Hmm.
Obviously, I was during my residency, so I never got time to study, and I
Yeah.
obviously flunked it. So, do I need to
Hmm.
reapply for all the eligibility and everything? Because it's
I
been
don't think
almost 20 years now.
20 years is a long time. Uh, that we will have to see, because eligibility, when I read it, it was clearly written that once you have got that eligibility, you don't have to apply it again for it any time in the lifetime. That is what I knew and what I have read. But definitely it's always better that you write an email to those people. They are very good in replying to emails, and you can put up your question in that email that I have already got this eligibility, should I apply it for this again?
Okay, so I could just probably
Because-
even just use my old email from that time and just reply saying,
yes.
should I just uh, reapply for the eligibility?
Because yes, because when I applied for it and everyone was like applying, it was perfectly said that even if you don't pass it this time, you don't have to apply further for the eligibility. But 20 years is quite a time, so it's always better to write them directly and get the answer directly from them only.
Thank you.
Yeah. Okay then. Good night, people.
Good night.
Good
Good
night.
night.
Good night. Thank you.
Good night, ma'am. Thank you.
Good night.